Well, dear students, not all of the themes and topics and concepts and chapters that we have to include in the class can be our favorites, and obviously there's got to be one that is our least favorite, and this is it. Chapter 9, Health and Disability Insurance. Psst. Here are a few words to the wise. Don't get sick. More Americans wanted the healthcare bill to actually do more. This is a very politically charged issue, and in a very politically charged time in our country's history. And so if you go nosing about, you're going to see very varied opinions and thoughts and ideas, some of which are totally nuts. Others are pie in the sky, so to speak, and then there's the in-between. But it's very difficult to have a serious, somber discussion about what we're going to do with health care in our country. But we're going to have to. I mean, aren't we? Let's get started on slide number 2. The United States has the highest per capita medical expenditures of any industrialized country in the world. And we're looking at over $12,000 in 2020. Now, you go over, nose around, you'll find different numbers, but that's a huge amount. In other words, every man, woman, and child wrote a check in 2020 for over $12,000. Now, you don't believe me, because many, especially you young folks, you're in great health. Just hang on. This is over twice as much as the average for 24 industrialized countries in Europe and North America, meaning Canada. In 1965, 6% of our gross domestic product, which is all the goods and services that our country has created, went to medical expenditures. But by 2017, that had gone up to almost 18%. And by 2026, they're looking at almost 20%. In other words, 1/5 of the economy, 1 person and 5 will be working in the healthcare industry. And I heard an economist say it very well. Americans want too much of a very good thing. Yes, we have the best healthcare system in the world, folks. In the industrialized world, let's say. And we have the worst healthcare system in the industrialized world. What? Well, it's great if you can afford it or have good insurance. It's not so great if you can't afford it, is it? Well, why does healthcare cost so much? Slide number 3. Because we have very expensive, sophisticated, marvelous, and some not so marvelous technologies. We duplicate tests and technologies. That was one of the main themes of the Affordable Care Act, Obamacare as it's called, was to get the act together so that the companies and hospitals and all of them would talk to one another about what has this person already done? Why do another MRI for $1,300? The variety, the frequency, but here are the two main ones. The administrative costs, the insurance companies. And this is the reason it's very difficult to have an honest conversation, because the insurance companies don't want to they don't want to lose a pretty darn sweet deal. 1/4 of every dollar goes to administration. And you look at socialized countries like Canada, and about 1% goes to administration. The same thing is true of Medicare, which is a socialized medical system for the elderly. About 1% goes to the administration. You see why the insurance companies, they don't want to let go of this. Plus, we're just getting older. And here's the statistic, which at first I thought, I don't know. And then I thought, oh yeah. From ages 60 to 70, the average person uses more healthcare resources than they did from ages 0 to 59. And I'm one of them. I'm experiencing this Oh yeah, you're gonna have to do that. Oh my goodness. Oh, that costs a lot of money. Oh my goodness. These are the most significant reasons, especially these last two. Malpractice insurance is often used as a scapegoat for spiraling costs, but it's a very small amount, except in some cases, such as obstetrics and gynecology, in which case the malpractice insurance is outrageous. Because if a child passes away in childbirth, I mean, obviously that's horrible. 100 years ago, 1,000 years ago, 10,000 years ago, happened all the time. So these are the two big: the administrative costs and the fact that we're just getting older. What is being done about the high cost of healthcare? Well, the real answer is not much. Are you willing to forego your medical care? There is some incentives now. There are some incentives to review the fees and charges to get people to take care of themselves because it just makes more sense to get somebody's diabetes under control, and as opposed to letting them wind up at the emergency room. And of course, getting people out of the hospital as quickly as possible because that's the most expensive hotel in town. Community education programs to get people to take better care of themselves because preventative care is almost always better and cheaper than actually waiting until somebody's sick. What I absolutely hate, because I'm a big fan of bicycles, is they always show a couple happy on bicycles. I mean, I don't hate it because I wish more people would use bicycles. But, these people, they put the bicycles in the back of the SUV, drive from Lakeside down to Mission Bay, ride around the bay 10 miles flat, and then drive home. And then medical vacations. This is exploding, folks. In 2007, there were 750,000. In 2019, over 2 million and 11 million worldwide. Would you go to Mexico or the Philippines or South Korea to have your gallbladder removed or whatever? We'll give you $5,000 and pay your airfare because it's going to be a whole lot cheaper to do it there. And here at the border with San Diego and Tijuana, many people go across the border for their health care. In fact, all you got to do is walk across the border and there's a huge medical complex right there. They have a huge parking lot for people who want to drive. So think about it. Think about it. Would you do it? Would you do it? I was once, a little story. I was once in Mexico where I had to have some dental work done. I had to have it. It was in pain. It was a root canal. And I came back and my dentist said, no, they did a very good job. I have no complaints, he said. I have no complaints. So still there. Which would you choose? You're 34 years old and you've been smoking for 20 years because it was really cool at 14 to start smoking. Recently, you've been experiencing severe abdominal pain and a nagging cough. You go to your family doctor who sends you immediately to the hospital. After a few tests, the specialist asks you to sit down with her and tells you that you have stage 4 lung cancer that has spread to your liver and spine. She tells you probably have 3, 6, maybe 9 months to live. She gives you 2 choices. She says you can decide to forego radical treatment. Instead, you're given pain medication, placed in hospice care after 2 months, and your chances of living 5 years are 1 in 1,000. You die in 4 months. The other choice is to undergo the radical treatment. You have surgery, radiation, several rounds of chemotherapy. Your chances of living 5 years are 1 in 85, 90, and you die in 9 months. Now, nobody can make this decision until it slaps them in the face. And then even then, they're torn because either way, it's not a fun way to die, folks. And the second way, you talk to people who've gone through it, and they'll often say, no, it wasn't worth it. It's not worth it because the chemotherapy will kill you if the cancer doesn't. Yeah, it's so destructive, the chemotherapy, what it does to people. But let's take a look at it from a financial standpoint. The total cost here is about maybe $100,000, 90,000, maybe less depending on your situation. But here it's about $1.5 million. So when I told you at the beginning of the presentation that every man, woman, and child wrote a check for over $12,000, you did not believe me. Now are you starting to believe me? And that ain't all. The average cost of diabetes is over $9,000, $16,000 for the related healthcare problems. Post-traumatic stress syndrome, $20,000 a year. Cystic fibrosis, over $15,000. A lung transplant, almost $1 million. A heart transplant, over $1 million. And the anti-rejection drugs cost an average of $30,000 per year for the rest of your life. So now, do you believe me? 1% of patients use 22% of medical resources, 5% use 50%, and 1/3 of all Medicare dollars are spent in the last year of life keeping people alive for an extra 2 or 3 months. Wow. So now, hopefully, you're starting to believe me, even though you're young and you feel great and you don't have any problems whatsoever and you're not smoking, hopefully, even though you feel great. That's the problem. We told you back in chapter 1, the problem with these anti-smoking campaigns is they go after the health hazards, but young people, they feel fabulous. They don't, even they're smoking, go after the financial hazards. What can be done about these costs? Death panels. This is the problem with the discussion. It's not a discussion. It's a way to try to hurt each other. In 2008, while then senator, before president, Obama was campaigning for the presidency and making healthcare his primary focus, his primary caregiver when he was a child, his grandmother, was dying. And he saw the heroic and costly efforts that were used to keep her alive for an extra few months. So along with his campaign promises to rein in healthcare costs, he floated the idea of giving Medicare patients in the last few months of life information about options such as hospice cares. And what did the opponents do? Right. They quickly accused them of wanting to create death panels. And to this day, when you ask people if the Affordable Health Care, also called Obamacare, still contains death panels, they still believe that it does, even though there was never any discussion of death panels. This is the problem we have with our discussion, our debate, our debacle of healthcare in the United States of Armenia. Let's speak about the Affordable Care Act. It's also called Obamacare, and this is why the Democrats are truly stupid. They should have called it Romney Care, because it was the Heritage Foundation, a conservative think tank group that originally proposed the idea and implemented by Governor Mitt Romney in Massachusetts in 2006. You can't make this up. Fact is always stranger than fiction. You create these large health insurance exchanges trying to promote competition. You create a health insurance mandate encouraging the young and the healthy to have insurance to pay for the folks who are older and sicker and people who cannot be denied insurance because of pre-existing conditions. Now, for decades, the insurance companies would not allow this. Pre-existing conditions, no way. We don't want to have somebody who's sick. But the discussion, the carrot was, hey, we'll make sure everybody has to go out and buy health insurance. That was the mandate, right? And so the insurance company said, okay, we'll go along with it. And if they hadn't, and if they had, they would have killed it. They're very, very powerful, folks. Insurance companies are not to be trifled with. Now, Romney Care, the Affordable Care Act provisions, have worked well in Massachusetts, which is a more affluent state, more highly educated. Is Obamacare working at the national level? Well, there are some successes and there are not so successful, because the news has been filled over the years with cries of Republicans who would do anything, including shutting down the government and defaulting on the debt to overturn it. But since the last vote, where then Senator McCain, who was, by the way, dying of brain cancer, voted it down, there hasn't been a whole lot of discussion. So we'll see what happens, even though people still jump up and down and say they hate Obamacare. How can you reduce your personal health care costs? Well, stay well. Yeah, sure, right, Mom. Eat a mostly plant-based diet. I know that's going to make me real popular. Reduce your total meat, dairy, sweets consumption. How much sugar is in a soda? We now in the face-to-face class, we'll show a couple of videos, and there are several out there, folks. All you got to do is type in, so drinking soda. What does drinking soda do to you? There's a real cute one about the Coca-Cola bears, the real Coca-Cola bears, who get diabetes and gain weight and have tooth decay. So it's interesting. Coca-Cola used to publish their statistics of how much people drank until people like me started using it against them, and they stopped doing that. So the data is sketchy. It turns out the largest consumers of largest in terms of how much and how much they weigh are Mexicans. And you ustedes que tienen parientes en Mexico ya saben, you already know this. But Mexico, and not only Mexico, a few other countries, have gone on a kick where they put labels. This is excessive sugar. This is excessive calories. This is not very nutritive. And it hasn't gone down by much, from over 700 to over 600, but it's gone down. Their consumption of Coca-Cola has gone down. Our consumption's gone up from 400 and something to 500. So stuff's not good for you, folks. Don't smoke, of course. Believe it or not, I know, again, you're not going to like this because this is what the science is saying. There's really no amount of alcohol that's safe. None. I love deep, rich red wine, but it's not good for me. Get enough rest, relaxation, stress, meditation, maybe exercise. If exercise with a pill, and they're still doing it. The drug companies are trying to find ways to put exercise in a pill because we need exercise. But I'm better now, but whenever I thought about exercise, whenever I had the urge to exercise, I would lie down until the urge went away. But now, no, I get my exercise. Yes, I know I don't really want to, but I am. Do financial health and medical health have any correlation? The answer is yes. Yes, you do not want to be abjectly poor because your health is affected by it. But being, fabulously wealthy doesn't really help. But there's a certain cutoff, once you go over a certain amount, it really does help your health, your medical health. Okay. Health insurance, which is why we're doing this in the first place, alleviates the financial burdens people suffer due to illness or injury. It's part of your overall risk management plan to safeguard your family's economic security. Excuse me. Pardon me. Because a week in the hospital can literally kill you. Financially, that is. How much is a week in the hospital? There's always at least 5 digits, maybe 6. 26 million Americans, that's under 10%, now have no health insurance. Now, this is a new low. So the Obamacare, the Affordable Care Act, the Romney Care, and a few of the other things that the Democrats have hammered out since Biden took office, have pushed it down to a level that has been never seen. Which is a good thing, folks. Why? Because if people have health insurance, they're more likely to get the care they need, as opposed to putting it off until they wind up in the emergency room, and now it's going to cost $500,000. Why don't we hear more about this? This is good news. I guess the outrage over critical race theory is much more important to the news outlets. I don't know, because an educated electorate, an educated citizenry, is really needed to deal with this issue, because we all want everyone to be healthy, right? Yes? I don't know. Maybe some people don't. Types of healthcare coverages. Well, there's the comprehensive major medical insurance, sometimes called the Cadillac plan. I don't know. People really, some of the young folks don't even know what a Cadillac is. Maybe you heard of it. The luxurious plan. Now there are low deductible and high deductibles offered, and we'll discuss the deductibility. There's some insurance called hospital indemnity, which pays a fixed amount each day you're in the hospital. It's cheap, but it's not very useful. There are these dread disease and cancer insurance policies, which are great if you get the disease that the insurance is for. But if you don't get cancer and you get hepatitis B, which can be just as deadly, they don't pay anything. They're often sold by people working on commission, expensive and not very useful unless you get that situation. Now, when are you going to be? When is this going to be solicited to you? There are insurance companies, not we won't name names. Aflac, they're not the only ones, but they will contract with big employers and run their healthcare system, right? They will also then, at the yearly sign up or every 6 months sign up, they will then try to sell them other policies, such as the cancer policies. And I got to tell you, folks, again, I'm an insurance agent. The commissions are very lucrative for people selling cancer insurance. So I'm not saying you shouldn't get it, especially if there's a history of cancer in your family. Guess what? They're going to look, and if they see a history of cancer in your family, they're probably not going to sell you the policy. You see what you're up against? I hope you I hope you do look at the video, which I Chris show in the face-to-face class, called Insurance Company Rules. It's it's kind of dark, but it's trying to be funny about a situation that is very, very serious. Dental insurance is separate. Vision insurance is separate. And again, these are ancillary policies that if you work for a company that offers insurance, the insurance agents will often sell them. And again, look at them with an eye toward what are they actually charging you, what are they actually paying you. Our vision care is about the same as if you went to a, not a very expensive optometrist and bought a single pair of glasses every year. So whoopee. You pay for the insurance and they give it right back to you, maybe. And then long-term care insurance, which was virtually unknown 20, 30 years ago, but is now growing faster than any other form of insurance. This is because the baby boom generation is seeing their elderly folks, and now it's happening to the baby boomers, wind up in long-term care, and they just don't have the funds. They have not saved enough to pay for long-term care. So they're saying, uh-oh, I think I need to get this insurance. But be careful because it's, excuse me, not that cheap. And if you were to start a savings program that we'll discuss investments and savings, you would be fine. You would be able to self-insure yourself by the time you needed it. And if you don't need it, great. You got that money to go travel around the world. A good health insurance plan should offer basic coverage for hospitals and doctor bills, the hospital and doctor bills, pay at least 80% of out-of-hospital expenses after the yearly deductible is met, but also have a stop-loss provision. Limit your out-of-pocket expenses to no more than $5,000 to $10,000 in a year. Again, doesn't include dental, optical, prescription. Some have prescription costs, but mostly that's separate. So think about it, folks. If you're limited to paying only 20%, still, if you have a $100,000 bill, that's $20,000. So most all policies will have this stop-loss provision. Once you've paid a certain amount of money, it used to be the deductible was included. Now you got to pay the deductible and then the stop-loss amount. You don't have to pay any more. So great. It's a catastrophic protection. It's a guarantee against catastrophic protection. The Affordable Care Act removed the typical $1 million restriction and the typical 1 year pre-existing exclusion for health insurance, as we talked about. No, they can't say, okay, yeah, we'll take you, but we're not going to pay for your diabetes care. No, they can't do that anymore. When Americans are asked if they like the provisions of the Affordable Care Act without naming the law or referring to Obama, they overwhelmingly say, "Oh yeah, this is good. This is the way it should be." I mean, you shouldn't be limited to $1 million, especially if you have cystic fibrosis. When they asked if they liked Obamacare, they overwhelmingly say no, because it's politically charged. Okay, where do you get your health insurance? Well, there are several articles out there and a really great video. I can't find it anymore because it was a doctor who now is an investment counselor, but he was a doctor. He still is a doctor. They called it an accident of history. It was just understood for decades that if you got a job, you got health insurance. Now, where did this come from? It came from World War II, when the government said you cannot give pay raises. They freeze the pay raises to the employers. You couldn't give your employees pay raises. And because a lot of men were in the war and a lot of women were in the war, companies had a hard time attracting talent. So they started giving them health insurance as an incentive to work for them. After World War II, there was a bit of a societal discussion. How are we going to continue with this? Well, in Europe, they said we are going to continue our system where the government basically offered the health care to the citizens, whereas it started to become a political issue here. That's what those socialist countries do. So it was just no, this is it. If you have a job, you get health insurance. But now employers are not too happy about this because it just keeps getting more and more expensive. So they're pushing more and more onto the individuals. But group plans are the norm and comprise about 90% of all health insurance issued. Individual policies will typically cost more, but not always. And of course, it helps to shop around. And then there's the Obamacare, the Affordable Care Health Exchanges, the supermarket in California. It's coveredca.com, right? coveredca.com. And then two innovations that have been, decades in the making are managed care. HMOs and PPOs. HMO is a health maintenance organization, and then preferred provider organization is somewhat basically the same, but it allows more choice. You have fewer restrictions and more choices. The HMO, you have this, they call it the gatekeeper, the troll, the provider, the what's their first name? I'm sorry, I'm forgetting the person name, but your general practitioner, your healthcare provider, the person you have to go to first before they'll send you to the gastroenterologist or the dermatologist. They supposedly focus on prevention and wellness. Again, there's the photos of the elderly couple with their bicycles smiling at one another. Whereas the PPO is the same idea, but if you stay in their network, it's going to be cheaper. And if you go out of the network, it's not going to be as much as the HMO. It's going to cost more, of course. So for years, my wife and I did not really want to be part of the HMO through Southwestern. But then we finally bit the bullet and we found a really good one. We were very happy with Sharp. Other people have told me they're very happy with Scripps. Other people have told me they're happy with Kaiser, not so happy with Kaiser. So you decide. And then we have a friend who has a PPO and he pays for it, but he's very, very happy with it. And so go shop around, dear students. I can tell you that our HMO has been very, very good to us. So we have no complaints about Sharp. Congratulations, Sharp. And I didn't get paid to do that, and I'm not getting any kickback or anything. Now, here's what I call, and some people in the industry might call it that, catastrophic health insurance. It's not really called that. It's called low-cost, high-deductible insurance. It's really that Cadillac, that luxurious plan that we talked about at the beginning of our health insurance discussion. But the deal is that the deductible is $8,000. So yikes, it's protecting you against being hit with a $70,000, $150,000 bill, but you could wind up spending a good bit. You pay out of pocket, and that really does help negotiate lower fees. You just use this magic this magic little four-letter word, cash. And often when we had this many years ago, I was able to negotiate discounts with only one doctor said, no way. I said, okay, fine, whatever. But usually they don't have to deal with the insurance company. It's less overhead for them. They get the money right then. You're protected against large losses, and these are great for small businesses, self-employed, because then you're eligible for what is called a health savings account. Now, that's really an investment account, a health savings account. They're very cool, and we don't spend a whole lot of time talking about them because not too many people are actually eligible for them. But if you are, they are a very cool way to put money away, tax deferred, tax free, and if you use it for health care, you don't pay any taxes, and then eventually, once you turn 65, I think the number is, then you can use it for pretty much anything. So it's another it's a backdoor retirement account, but it's the idea to use it for health care. And this is not to be confused with what are called flexible spending accounts, which are a little different wrinkle. Your employer can offer these FSAs, flexible spending accounts. You put money in the FSA. The only thing different about the FSA, though, you get you don't pay taxes on it, but you have to use it that year. You must use it. If you don't, you lose it. Now you can roll over a little bit to the next year, but you still have to. It's very difficult. It's very difficult to plan, especially if you're in really good health, because you don't know if something major is going to happen. But if you know you have certain healthcare costs, you can use an FSA if your employer has it. The HSA, though, is not tied to the employer. It's tied to you, and you get to keep it, which is cool. Okay, what's MIB, Men in Black? Now, this is the Medical Information Bureau. Do you remember the credit bureaus, and then the Nexus Lexus? This is the same idea. The Medical Information Bureau operates much in the same manner as the credit reporting agencies. These are used by life insurance companies in much the same manner as the credit reports and the clue reports that we talked about. Protected by the same laws. So again, you were allowed one free report each year. And this is many years ago. I was going to a doctor and they had all this stuff they wanted me to sign. I said, well, I don't want any of my information going to the MIB. And the woman said, what? I said, I don't want you to give it to the Medical Information Bureau. And she said, well, let me go talk to the doctor. Doctor comes out. He's very angry. He says, what are you talking about? What is this MIB? I said, do you have internet access? He goes, yeah. I said, go type in MIB.com. And he comes back, he goes, this is really interesting. People in the healthcare field don't even know it's around. But sure, folks, if you've been diagnosed with HIV, you have the HIV bug, and it winds its way into MIB, no insurance company is going to touch you. You're right. Your life insurance company, that isn't. The life insurance, not the health insurance. So remember the MIB. Check to make sure that there's nothing untoward in your Medical Information Bureau report. Okay. What about the government healthcare programs? Don't care. Medicare. It's the federal program, socialized program for those 65 or older, and certain disabled persons. And you know what? It's worked. It's not anything we've done, anything humans have created is not perfect. We know that. There's quite a bit of fraud going on in Medicare, but there's quite a bit of fraud in healthcare everywhere. But it's actually worked pretty darn well. Now, you have an HMO option in Medicare, which gets maligned by some people and praised by others. And again, it depends on which one you choose. So you have to choose carefully. And then there's prescription part D, and sometimes the part D is rolled into the part C. But everybody gets A, and if you've qualified for Medicare, which you've worked for 10 years and you've contributed to society, The B is voluntary, but it really does make sense for you to get it unless you're going to leave the country. I mean, if you're not going to be, if you're going to retire abroad somewhere, and we'll discuss that at the end of the semester. The only problem is if you come back, they're not going to say, oh, okay, you've been fine for 7 years, but now you're sick and you want to come back and all of a sudden use our healthcare system. They're going to go back and charge you for the years that you weren't there. Yeah, they're not not going to let you get away with that. It used to be that everybody paid the same, but now it's means tested, which means if you make over a certain amount of money, you're going to pay higher amounts, which, it's not something when they created it that they wanted to happen, the folks who designed it, because then what happens is it sort of becomes a rich versus poor system, and the rich have more power than the poor, but that's the way it is. If you're indigent, we have a system called Medicaid, which in California we call Medi-Cal. For low-income people, it's administered by the state, but it's basically guidelines are the feds, and the feds pay for most of it. So you hear people, in fact, this is one of the quotes of the year back, I think in 2009 or 10. You keep your government mitts off of my Medicare. Some irate citizen said to his elected representative, and the representative, but sir, Medicare is a government. Okay, now time to switch gears and take a look at disability income insurance. This is one of the most neglected, if not the most neglected forms of insurance. Sounds like a test question. And there's reasons why. First of all, it's not easy to find, and it's expensive and not very useful. Oh boy. But it protects your most valuable asset, your ability to earn an income. And people go, what? What are you talking about? No, you don't understand. Your health is your most valuable asset, especially if you're the breadwinner. If you had a machine in your basement or your garage pumping out $60,000 $1 bills every year, would you have that machine insured? Yeah, well, that's you. Aim for a benefit that when added to your other income will equal about 60 to 70% of your take-home pay. You're not going to find any that exceed more than 70%. It will only pay if you cannot work at any job. They used to have policies that say, look, if you can't work at your job, then we'll pay. No, they want you to get at any job. How long do the benefits last? To age 65, to life, usually 2 to 5 years. And what's the waiting period? The waiting period you could think of like the deductible. When we have a car crash, you have to pay the first $500. If you have health care, you have to pay the first $2,000. Well, in here, you have to wait 90 days or 180 days. And of course, the longer the waiting period, the lower the premium. The weird thing, or I don't know, the insurance company's not stupid. The typical disability lasts from 3 to 6 months. So you see what they're doing? It's not typical that people are disabled forever, but that happens too. But in this case, they have a waiting period that's about the length of a typical disability. Somebody tears their Achilles heel or whatever. Right. Now, there are 4 sources. As we said, the employers often have a representative come from the insurance company who will sell them extra policies. And we used to have at Southwestern a very good disability insurance policy. Then it disappeared, and now we have one that's not so good. Individual disability insurance, it's very hard to find. And if you find it, it's fairly expensive and restrictive. And we're going to ask you to go out and find one. And the one that most people find is the one through Mutual of Omaha. So I give you the website. Go ahead. That's part of your assignment. Social Security has disability, but only for those that last more than a year. And my understanding is if you can actually get through the system and be awarded the total disability, you are not disabled. It's that difficult. So they have people who try to help you through it. And then in California, the workmen's compensation program is not functional. It's a very dysfunctional system, I can tell you, because I had to go through it. I didn't want to. I had no, I tried my best to get out of it, and they said, no, you have to make the system work for you. And it doesn't work. But any politician, I don't know if you remember the governor, the Gropinator, what's his name? I forget. I don't know. He said he was going to fix the workmen's compensation system in California. He couldn't do it. So whatever politician says they can do it, I wish them a whole lot of luck. Because remember, we said horrible things about insurance companies. There are also horrible things to say about lawyers. Slide 21. The bottom line on health insurance. Bohica. You remember Bohica? Bend over here, it comes again. It's right. It's pretty much the bottom line on all insurance, dear students. Keep your back to the wall. And oh yeah, don't forget, don't get sick. So my apologies. It's not a pleasant subject. It's a very difficult subject to discuss, especially with people who are polarized in their political views. But we leave it to you, dear younger students, you millennials, you Gen Z as they're being called, because we got to fix it. There's no way we can't. It's going to eat us alive. But at the same time, it's incredibly marvelous what our healthcare system has done. We're going to cure cancer. We're doing it. It's chemotherapy. Someday we'll go back and look at it as if it was like draining people's blood using leeches. It's such a barbaric way to try to save people. It doesn't usually work. And it's all going to happen, but it's not free. So on that happy note, we stop our discussion of healthcare and disability insurance, and we look forward to our last discussion, our last chapter on insurance, where we discuss life insurance. And there's some hope in this case because life insurance is important for, especially if people have kids, and you're going to find that it's not that expensive if you buy the right insurance. And we're going to make sure you know how and what insurance to buy. And remember, you're going to be the financial guru for your friends and family and coworkers, and you're going to help them not get suckered in by the evil, the necessary evil. See you in our last presentation on insurance, life insurance.